Hello everyone. So my policy that I chose um, was for the shortage of nursing educators. So we've had a shortage of nursing educators for a while. This is not a new issue that we're seeing, but it has been exacerbated by recent events such as COVID. The nursing shortage in general has made it harder for nursing educators to get through school, and it's just not a flourishing field. So the policy that I chose that I felt like would be most effective in this shortage was the Nurse Precept Act, which was in the Senate. So the Nurse Precept Act would give nurse preceptors that meet eligible criteria, which was 200 hours of precepting hours at a acceptable area of need and college that is approved in the stipulations that it would have. But it would give a $2,000 tax credit to nurse preceptors. Now, I think that this is the most reasonable bill for this topic, for the shortage, because it is going to give money directly to the nurses that it is infecting. So the nursing shortage, some of the different factors that we've seen in this. So, it's a negative cycle. There's more people retiring than there is going into this field. That is also because of different things. So the qualification standards, you can have a master's, you can have a PhD. There's not a core curriculum that's used in all education criteria. So there's a variation of possible degrees. This is a different political, legal factor. The wage gap is the one that I feel like is the most having the most effect on the shortage. So advanced practice registered nurses are making over $30,000 more than a master's level educator with a similar degree. This is an economic factor, which I feel like is one of the biggest factors. So, these nurses are going to go to school for longer to get a master's or PhD, and they're going to get paid significantly less than other nurses just doing clinical nursing. So why would they want to do that? It has to be, we have to make them want to do that and make it more attractive. And I think that the wage gap is the biggest way that we're going to see an effect on that for nursing educators. Inadequate preparation is another. This is a social ethical factor that we're looking at. Many schools are hiring and looking past skills and expertise because they are in need of nurse educators, and they're taking what they can get and trying to make do with nurses that may not have adequate schooling or adequate preparation to teach nursing. Another one is a lack of role recognition. Roles and responsibilities vary from position to school. This leads to confusion. It's a social factor that we're seeing. We talked about the high rate of retirement. A majority of the nursing faculty that we have currently, they're nearing the age of retirement. So we are not producing enough nursing educators to replace those retiring. When we see more people retiring, we're looking at a limited number of seats in nursing school. We're already facing a nursing shortage in general, and by having a shortage of nursing educators, we're limiting the amount of seats and possibilities that we have for future nurses to even start out. So this is really something that we need to take seriously and that we need to make changes for. The political legal issue is that due to the faculty shortage, we're seeing a number of students turned down due to limited seats available in nursing programs. So there are a couple bills that I looked at for this. The Nurse Precept Act is the one that I think is the one that would see the most effect and change the most for us. But they also have, there's another bill that was called the Train More Nurses Act. This is to potentially change the grant process for nursing students, just to make it easier for them to take grants and get scholarships, and maybe even lessen the cost that they have to pay to get these higher degrees to teach. And then the Missouri State Loan Repayment Program. This is the loan repayment program for healthcare professionals, including nurses. They do just require you to work in a area of need. This is a contracted thing between you and the Missouri State Loan Repayment Program, and it is normally done in the final year of school. So this is to help repay student loans, which does help nurse educators, but it's not giving them money directly, which I think is the issue, because we're not fighting to pay loans. We're fighting to pay to live, because it's so expensive in this economy, and it's not worth it to have a high degree and have high student loans and then be getting paid $30,000 less than a similar degree would be. So we're looking at that. Stakeholders in this issue. So of course we're looking at students, we're looking at nurse preceptors, nurse educators, academic institutions, the schools that we are hiring, working at, seeing, clinical sites, the hospitals that you're working at. They're going to have, they have to be in an area of need for the Nurse Precept Act. Those were internal stakeholders. External stakeholders would include like the Missouri Board of Nursing. We're facing a nursing shortage. This directly affects the nursing shortage. Patients, general population. You know, we as nurses take care of patients in the general population. They may have thoughts on this. Clinical students take care of patients. Missouri senators and representatives, they're the ones voting on this. They're the ones that need to be involved enough to know why they're voting on it, why we need to make differences, why we need to make changes. And then another one would be the American Association of Colleges of Nursing. They're just involved because they are an association that looks at colleges of nursing, which is where nursing educators teach, where we get the next generation of nurses coming out, and they support this bill because it does help directly get money to the nursing educators and preceptors that are qualified for it. So the advocacy strategies that I looked at for this to reach all of my stakeholders, you know, there's a lot of people involved in that, and it's going to be hard to get that to everybody. But realistically, the easiest way would be to have everybody meet at once at a some kind of an event. Otherwise, virtually, we could send emails, we could have online platforms that we could access, but meeting in person would allow for everyone to have their opinions voiced, everyone to listen, to have good discussion about this, to educate on this subject, and it would just give everyone a chance to be involved in it. So, you know, looking at that was a lot of different levels of education as well that we're looking at, though, going from, you know, nursing educators and nursing academic institutions versus the general population. There's going to be a big difference in what they understand. So getting this information out to them about the event would look differently too. So for students, academic institutions, we could send an email with different verbiage on why this is happening, what it's going to talk about. For the population, it would probably need to be simplified a little bit more, just for general understanding, and then they can learn at this event more in depth about the topic and the presentation. But to conclude all of that, my topic was the shortage of nursing educators. My policy that I support in this is the Nurse Precept Act. I think that would be the most beneficial option for us to look at and support to help improve the shortage of nursing educators. So, thank you for listening.